Hello, everyone. I'd like to take a few moments to honor and recognize a true leader, an advocate for those impacted by kidney disease, and dedicated public servant, Dr. Griffin Rodgers of the National Institute of Health, National Institute of Diabetes, Digestive and Kidney Diseases. It is my distinct honor to present Dr. Rodgers with the 2021 AAKP National President's Award. We're presenting this award for courage and leadership during the national COVID-19 pandemic and for his ongoing commitment to America's long-term scientific research, discovery, and innovative endeavors designed to prevent and treat disease and save human life. As a dedicated U.S. civil servant and esteemed healthcare professional, this award recognizes Dr. Rodgers' relentless dedication to the kidney patient community, his public service, and America's historic role as a leader in advanced research, medical innovation, and kidney care treatments. His empathy for those who suffer from kidney disease as well as their families and communities is distinct and well known among kidney patients and medical professionals. His commitment to the inclusion of kidney patients and their unique insights and data across NIH, NIDDK has helped model best patient engagement practices for all federal agencies, research institutions, and even the private sector. Notably, the leadership Dr. Rodgers and his team are demonstrating this day through the Kidney Precision Medicine Project, APOL1 genetic research, and other strategic initiatives have earned NIH and NIDDK an international reputation for including kidney patients as co-researchers whose life experiences are both valued and essential for future scientific breakthroughs. AAKP is honored to present the following award to Dr. Griffin Rodgers for his continued support of advancements and innovations that impact the kidney community. Congratulations, Dr. Rodgers. I would like to invite you to say a few words.
Well, greetings from Bethesda. I'm Dr. Griffin Rodgers, Director of the National Institute of Diabetes, Digestive and Kidney Diseases, or NIDDK, at the National Institutes of Health. I'm pleased and honored to receive the 2021 AAKP National President's Award. The past year has been one to try all our souls. With that in mind, I accept this honor not only for myself, but on behalf of the truly dedicated staff at NIDDK. Even during such challenging times as COVID-19 pandemic, the NIDDK has sought to advance research, advance rare diseases, and develop precision medicine relevant to kidney diseases. For example, you know that there are many different ways people develop and experience chronic kidney disease, but need to learn more to turn this into benefit for patients. Much of our research would not be possible without the partnership of altruistic volunteers. Through the Kidney Precision Medicine Project, or KPMP, these research partners have donated precious kidney samples, helping the project to characterize subgroups of patients with CKD. This tremendous effort could make personalized, effective, and safe treatments a reality. We're also supporting research to reverse the disparate burden of kidney disease and failure on those at highest risk, including many of you in the audience, such as by understanding how genes handed down from our ancestors affect disease risk and response to therapies today. For example, variants of the APOL1 gene has long protected people in sub-Saharan Africa from the threat of sleeping sickness, a devastating parasitic disease. However, they greatly increase the risk of CKD and kidney failure in Black Americans. The Apollo study hopes to improve kidney transplant outcomes in Black Americans by studying the impact of high-risk APOL1 gene variants in Black kidney donors and their recipients. At the same time, wouldn't it be great if we could eventually improve health and avoid dialysis through repair or replacement of damaged kidneys, without involving human donors? This is the goal of our Rebuilding a Kidney Consortium. The RBK has brought together scientists with diverse expertise to tackle complex challenges to help to repair, regenerate, and build key kidney components, and ultimately an entire bioartificial kidney for transplantation. And in a new world shaken by an insidious virus that will likely haunt us for some time, we are supporting important efforts to understand how SARS-CoV-2 infection and COVID-19 disease affect the kidney. These efforts focus on both short and long-term health issues. We're not only grappling with the acute kidney injury that can occur during active COVID-19 disease, but also the potential for new CKD or worsening of existing disease post-infection. In these and other efforts, we are supported by notable partnerships between AAKP and NIDDK. I would especially like to acknowledge and thank Mr. Richard Knight for his service on NIDDK's Advisory Council. The Council provides critical insight and recommendation that help guide NIDDK's research and research policy. For example, by assisting us with questions such as, how can NIDDK better address health disparities, such as those we see in many kidney diseases and in COVID-19? And how can NIDDK increase diversity among the researchers and research we support? I'd also like to acknowledge and thank Mr. Paul Conway for his service on the KPMP's External Evaluation Panel and his instrumental role in developing KPMP's communication plan. Most importantly, I want to recognize and acknowledge and thank the community of kidney patients, their families and caregivers, research volunteers and advocates. The NIDDK and the scientists we support are consistently helped, challenged, and guided by collaborations with participants of our kidney clinical studies and trials, like KPNP and Apollo. For example, KPMP patient volunteers are also partners in the study. They have not only undergone kidney biopsies, but they have also been involved from the very beginning as participants in the research process. They have gone to the meetings, asked questions, pushed the investigators to stay on track, and helped write the consent documents. Similarly, Apollo has a community advisory council made up of Black kidney donors and their recipients to provide valuable input on things like study design, recruitment, and retention of participants. Together, we are demonstrating that community engagement is not a soft concept, but hope and determination in action. And that's the message I like to end with today: hope and determination. It's what drives me in my own research. It motivates the biomedical research community. It encourages our research partners to join clinical studies and invigorates NIDDK's efforts focused on kidney and other diseases. I'm confident that this shared force of purpose will continue to benefit the community served by both NIDDK and AAKP, people with kidney disease and their families. Thank you again for this honor of this award, and please be well.
Thank you, Dr. Rodgers. You're well deserved of this award, and we appreciate your words and your insights. And on a personal note, I served on the NIDDK Advisory Council under the leadership of Dr. Rodgers for the past 4 years. And when I first joined, I thought that it was going to be interesting, but it turned out to be more interesting than I ever realized. Under Dr. Rodgers' leadership, I am just overwhelmed by the dedication to patient engagement by him and his team. It is thanks to him for his leadership and leaders of his nature who make certain that patient engagement is something that is truly part of the kidney community. Thank you, and enjoy the rest of the session.